This is Jessie. I'm going to be performing my MedPass. My Cardexes wouldn't print off of the computer, so here's my hand-copied Cardexes for Mr. Cooper John. Those are that was Cardex B on the first one. It's Cardex B. This is Cardex A. This is my chart. This is my doctor's orders. And this is my patient. All right. And that's my med cart, that box. I don't have a Pyxis. All right. The first thing I'm going to do is I'm going to compare my charts, my doctor's order, and my Cardexes to make sure all the medicine is the same. It's all the same route and it's all the same milligrams. And on here everything matches up. I am then going to do my 9 a.m. MedPass. So I'm going to check my 5 rights right away. I'm going to make sure I have the right drug, make sure I have the right patient, I'm going to make sure I have the right amount, the route, and the time. All right. Then I'm going to go and assess my patient. I'm going to check his labs to see if he has any labs that need to be done or anything like that. I'm going to take his vital signs. I'm going to assess him for any chest pain since my patient has COPD and he has a history of angina and depression. And I'm going to check his 5 rights again. I'm going to check his wristband. I'm going to have him say back his birthday just so that he can verify who I am. His, make sure he knows where he is, his conscious level. And then I'm going to go back to my nursing cart. This is for my Augmentin. And I'm going to prepare the meds. So on here, my doctor's orders and everything matched with the Cardex. So those are all good. I'm going to go to my chart. I'm going to go to my nursing cart. I'm going to open my drawer, and all my pills have been administered here. I have 1 inhaler of Atrovent. I have 20 milligrams of prednisone. I have 180 milligrams of Cardizem. I have 100 milligrams of Wellbutrin. I have 7.5 milligrams of Valium, and I had 2.5 milligrams of Albuterol. I also have 2 PRN medications that Mr. Cooper takes. He has Restorol and Nitrostat. Now the Restorol is for HS, every HS as needed. And since it's a 9 a.m. MedPass and he's been asleep all night, and he had a good night's sleep, he doesn't need the Restorol. And he hasn't had any excess chest pain, so I'm not going to administer the Nitrostat either. So then I'm going to ask Mr. Cooper how he would like to take his medicine. He'd like to take them 1 at a time. So I have my cup here. And Mr. Cooper, this is 20 milligrams of prednisone. And it's 20 milligrams of prednisone is a steroid. So there we go. This is your Valium, 7.5 milligrams. This is for your anxiety. And he's been drinking water with his pills. He just can't hold it. This is your Cardizem. This is for your chest pain, 180 milligrams. See that? This is your Wellbutrin. This is to help with your depression. And this is your albuterol. And this is to assist with your breathing. And then he drinks after each pill. And then he has one more, he has his inhaler. And after he's ingested all of those and he's ready, I have him exhale out all of his breath and breathe in his inhaler, just one puff, and hold it in there for about 5 to 10 seconds, and then exhale through pursed lips. And I'm going to sign off on my patient's chart that I did all these meds for my shift verification. And as I was at my nurse's cart getting ready the meds, I also did another Fibrite. I believe I had only told you I did it 2 times. I think I was opening the pills. As I was opening the pills and putting the pills in his pill cup and administering them one at a time, I was also making sure that I had the right medicine with the chart. And I was doing the Fibrites of drug route patient, drug route patient amount and time. And he got all of his 9 a.m. meds. He didn't need any of his PRNs. All of his meds were PO, and he had 1 inhaler, which was a 1 puff. And I'll come and check on Mr. Cooper and reassess to make sure that he's not having any extra chest pain or anything like that, to see if he does need the nitrostat later in time on my next MedPass round. Now for the Augmentin, I'll bring this over here. The bottle, when reconstituted, is 90 milliliters of water. We add 90 milliliters of water to the bottle. And through dimensional analysis, 1 dose is the 600 milligrams. Every 400 milligrams is 5 milliliters. So he'll need 7.5 milliliters of Augmentin. So I take my syringe and in my nursing cup for administration, I'm going to stick this in here and I'm going to pull out 3. Oops, get down far enough there. Make sure I have 3. Pour that in the cup. And 2.5 more. We'll then dispose of the dropper, and then the patient, I wish I had a smaller cup, but then the patient would then drink the Augmentin. Now, if I needed to crush my pills, we can use this as my simulator. The pills that are to be crushed, I would stick into the plastic bag, and I would stick it in my crusher, and I would crush the pills. And then I would mix it with soft food so that the patient would be able to, take it by mouth. And if I needed to separate a pill for it to be, say I needed 90 milligrams and the pill came in 180 milligrams, I would need to make sure that the pill is scored so that I know that I'm getting the right amount of medication administered to my patient. And I believe that covers my oral administration.